So, Dr. Raiputi, what are some of the contraindications for the ESG procedure that we were discussing?
So, Caitlin, good question. So, there are contraindications just like any other endoscopic procedure. So, ESG is an endoscopic sleeve gastroplasty where you're suturing the stomach from inside to reduce the volume and thereby gain weight loss, right?
Okay.
So, if let's say there are some medical conditions where they can't have an endoscopy done, it's an obvious contraindication.
Mm-hmm.
Or if the patient has cancer on the tissue, let's say stomach cancer, you can't do it. And if the patient had a surgery on the stomach, then it can be done because you don't have the normal anatomy for it to happen.
Okay. That
And
makes sense.
also having a large hiatal hernia. When the hernia is like when the stomach comes up above the diaphragm into the chest, we call it a hiatal hernia.
Mm-hmm.
And if they have a large hiatal hernia, usually the size can range from 1 centimeter to 5 centimeters or even more. Then smaller numbers might be okay, but if you have a large hiatal hernia, then it's not a good procedure to pursue. And then if you have any bleeding gastric lesions like ulcers, varices, or anything that can bleed in your stomach, then it's not a good procedure. Women who are pregnant, you can do it. And people who are on blood thinners or antiplatelet agents, it's probably not a good idea since you could have a lot of bleeding after. Some patients have coagulopathies where the blood clotting is a problem. Then they can bleed after the procedure, you can't do it.
Okay.
And the other thing is if you have a psychiatric condition which cannot be controlled or not on treatment, then you cannot do this procedure. And obviously they'll not stick to the routines.
Yeah.
Or the other thing is eating disorders. You might have heard about bulimia, anorexia nervosa, or things called rumination. So those conditions are also a contraindication to perform this procedure.